second level of glute medius weakness is what we call a retrotrendelenburg. Now these folks, and the reason that we say this is a progression, these folks have figured out, you know what, when I stand on one limb, my hip tends to fall. So what do? They tend to bring their center of gravity over to one side to help to stabilize that hip. It's no different than if you look at a stroke patient who has weakness of their quads. What do? They hyperextend their knee. Why do they hyperextend their knee? Because their quads are weak. Well, yes, but why else do they extend their knee? They hyperextend their knee to give them some form of stability. And if you look at the picture of this athlete right here, you see two things. One is that it helps to create stability at the hip because she's closing down her hip. But she's also bringing her center of gravity over so that her glute medius does not have to work as hard. And if you look at the EMG activity of her glute medius in that position, it's less than if she actually stands up in a more upright position. So if I'm standing like this, my glute medius is much more active than if I go like this. My glute medius starts to shut down. This motion has to be corrected. And if we don't identify it in the movement assessment and we let it carry through on all of our correctives, it will not change when they go back to sport. The final and the worst one is a corkscrew. So the level of the progression is you have a trendelenburg, you have a retrotrendelenburg, and then the final one is a corkscrew. And a corkscrew is simply a combination of a trendelenburg with rotation. And it is that rotational component that is the worst. Why? Because if we go back to looking at how we described articular cartilage is meant for the compression. This position, if you looked at the femoral head and the acetabulum, creates a lot of shear stress with that motion. And one of the easiest ways to identify that is that if you're looking at the athlete from the anterior view and you look at what their foot position is. In this instance, you see his foot is coming way out to the side. Now it may come out here, they may rotate the opposite way, but most of them will rotate this way. And it's when they come across this way, there has to be some form of a rotation in order for that to occur.